Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Providing Quality Dementia Care During COVID, Resources and Support from the Alzheimer's Association. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through this crisis, and thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members and potential members during the COVID crisis. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the questions pane on the right hand of your screen, and our presenters will address them at the end of the presentation. Today's webinar is being presented by Jessica Hill, Senior Program Manager, Jeff Dauber, Education and Outreach Coordinator, Jen Ebersole, Director, State Government Affairs, and Kellie Butsack, Associate Director, Programs, all with the Alzheimer's Association. Today you will learn more about dementia care practice recommendations that provide the cornerstone for how care should be delivered across the long-term care and community-based settings through a framework of person-centered care and about the statewide policy priorities at the Alzheimer's Association and the impacts due to COVID-19. Information will also be provided regarding resources that will address how to manage care during COVID-19 and gain a better understanding of the resources for both family caregivers and professionals in long-term care and home-based community settings. I'll now turn it over to Jessica.
Hi, thank you, Wendy, for that, and welcome everybody. On behalf of the Alzheimer's Association, I want to thank PHCA and all of you for having us today and for joining us in this new virtual world and allowing us to share some information with you that I hope you'll find very helpful. The Alzheimer's Association, our vision is a world without Alzheimer's and all other dementia. And our mission is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction, and early detection, and maximizing quality care and support. These statements reflect our commitment to ending its devastation, and they make clear our commitment to ensuring that all who face it have access to the information, resources, care and support that they need until we end that devastation from this disease. Today, we will share with you some information around policy and COVID's impact on long-term care, some COVID tips for long-term care and caregivers, as well as some insight into our new training, the Alzheimer's Association Person-Centered Dementia Care Training Program. This is a new online training program intended for professional care workers in long-term care and community-based services. It is based on current evidence-based person-centered practices to care for individuals living with dementia. And at this time, I will turn it over to our Ed and Outreach Coordinator, Jeffrey Dauber, with some more details.
Thanks so much, Jessica. Hi, everybody out there. First and foremost, thanks to all of you for joining us today. Thanks to Wendy and PHCA for collaborating with us on this and the rest of my colleagues. I'm going to turn my camera off now so you don't have to see me anymore. And we're going to get going. We're going to talk a little bit about defining quality care. And as Jessica mentioned, dementia care practice recommendations, or, we've got to have initials, so it's DCPR. So we'll get into this. Hopefully everything will go. So throughout the DCPR, Our quality care history come from guidelines for dignity, key elements of dementia care practice recommendations. These are all items that we've put out over the years. Quality care today. Let me hit the right thing. Evidence-based practices, 56 recommendations by 27 authors, applicable to various care settings and throughout the disease continuum. First published as a supplement to the February 2018 issue of the Gerontologist. It's a foundation for quality, person-centered care. So we'll look at the DCPR, the Dementia Care Practice Recommendations, and the rest of the lovely pieces of this pie wheel here. And as you can see in the middle, person-centered focused. Everything is centered around the individual and the people that we are taking care of. Person-centered focus. The recommendations are know the person, know who they are, know their history, get that information on them so we know who we're dealing with, what their past likes are, what their likes are, and those types of things. Know the reality. Where are they in the continuum? What is their reality? Where are they in the stage of the disease? So we can do that. We practice meaningful engagement that's meaningful to them so they can feel that they're a part, you know, and doing something meaningful. It's an authentic, caring relationship. We form supportive communities, and we evaluate care practices as we move through. So we'll look at this one, detection and diagnosis. Recommendations being information out there and education about brain health and cognitive aging. You know, how do we get to the public? How do we get to the public at large? And not only the folks that may be at this point, but we need to be able to have education and information about brain health and cognitive aging. What are the signs and symptoms of cognitive impairment? You know, so that we can be educating people to what they should be looking for. What are the things that are normal? What are the things that might be an issue? So the conversations can be started so people can start down the road for detection and diagnosis. Concerns, observations and changes, we just spoke about that. How do we recognize those? Routine procedures for assessment and referral, that's important because a lot of times folks don't know where to go or what to do if they have an issue. You know, going to the primary care, and how does that work, and how do they get a diagnosis out of primary care, and then how do they get referred on to neurology or neuropsych or wherever that may be. Brief mental status tests when appropriate. We're also working to get screening, cognitive screening in for folks over 65 as part of wellness visits. Those are some things we're working on as well, so that's important. Diagnostic evaluation follow through. If someone goes to the doctor, what are the referral steps? What is the follow through on that? And a better understanding of diagnosis overall. How does it work? Where do we go? What do we do if there is a diagnosis? So assessment and care planning. So we have early detection and diagnosis is important. Why? So we can do assessments and have care planning. Care planning is paramount to this disease. When folks get started, they seem to be on a little island. They don't know where to go. We need to be able to have care planning for them so that they can build through this. Regular comprehensive person-centered assessments, timely interim assessments, follow-up through the care planning, and then navigation of this disease. Information gathering, relationship building, education and support. These are all parts of the recommendation. So all of these things that we're going over now are all part of this DCPR, and these will be part of the recommended, you know, the trainings within it. Collaborative team approach. We need to be able to have a team approach all the way from the person-centered, the person with the disease, the family caregivers, personal caregivers, medical professionals. As we build out, you'll see that as we kind of move through this. So it needs to be a collaborative team approach. We need accessible documentation and communication systems. How do we follow and refer and do assessments and build this community without the communication? We need communication so that everybody's on the same page as we move through. And advanced planning. Like I said at the outset of this little section, that's important, getting the early detection and diagnosis so we can have planning as we move through, because there are a lot of different things that need to be planned for, as you'll see as we move through this. So we have medical management. Recommendations there. We want to have a holistic person-centered approach. What is good for that person? What is good for their needs, for their overall well-being? Very important. We cover role of medical providers. What are their role in the support system? Common comorbidities of aging. What makes this disease particularly tough is that as people get older, the main risk for the disease is being over the age of 65. As we get over the age of 65, we also have other health problems, comorbidities, problems that may exacerbate Alzheimer's or dementia, or that the Alzheimer's and dementia may exacerbate other conditions. We're looking for non-pharmacological interventions, as we always are. How do we approach different kinds of behaviors and communications within this disease so that we can stay non-pharma? Discusses pharmacological interventions when necessary, when other things don't work, when they have to be used, and also what is the communication, what is the medical collaboration on that, so that the correct medications are being given and there's not odd supplements that might be causing problems. So pharmacological interventions when necessary, but also as a team approach to make sure the right things are being done. Person-centered plan for possible medical and social crises. So when we're looking at the person, trying to see what is their support system, how do we manage the crisis? What if has to be hospitalization? What if there needs to be placement in a facility? So these are all important to have based on that person. And then as we move through, unfortunately, we know that this disease, we don't have a cure and that there will be end stage. So end of life care discussions are very important as we move through this as well. So in this section of the pie, information, education, and support, the recommendations, preparation for the future, work and planning. Once again, navigating the disease, assessments, care planning as we move through, planning for the future, how the early detection and diagnosis allows for us to navigate and care plan so that we can set up these things so that it works smoother and better, not only for the person with the disease, but for their caregivers. Culturally sensitive programs. How are we getting information to diverse audiences, to underserved audiences, so that they have the access to the services that they need. Education, information, and support during the transition, or during transition. So when folks are transitioning through stages of the disease, or transitioning, maybe from home care to, or from being cared for at home by a caregiver to having people have to come in the home, or have to maybe go to assisted living or a different kind of facility. Information on that. And technology to reach more families. How do we get out to reach the people that need it? We know that we need to reach a larger amount of folks because everybody's going to be affected by this. Also involved in here are activities of daily living, or ADLs. It provides support for ADL function. How are we assisting folks through their ADLs? How does person-centered care practices work within assisting them for ADLs? Dressing, dignity, respect, choice, process. One of the things we used to say is, cues and clues, not just giving people clothes to wear for the day, but given a choice between this shirt or that shirt, or choices, because that preserves their dignity. It does two things for them. It gives them a choice. And it also gives them a cue if they're maybe struggling in a more mid stage of the disease where they're not really sure. It helps them. And it also, that's a one-on-one. That's a one-on-one with them that provides a touch with them and support for that function. Toileting, health and biological considerations, eating, adaptations, functioning, food, beverage, appetite. How do we work around that? What are recommendations, for making sure that people can see their food, that they have a choice in food, that they're eating the foods, that are healthy for them. And these are all things that come in under the ADL section, and those are the recommendations there. So now we get into a big one, dementia-related behaviors, recommendations. So, we're going to talk about it, or people will be able to learn about social and physical and environmental triggers. We know that 95% of all challenging behaviors from someone with Alzheimer's or dementia comes from one of two things, either the environment, or the caregiver. So teaching how to interact, how to do a positive physical approach, how that we come in, from the front so we're not scaring people, and, we're assuring them that we're there, and making sure that the environment around them is amenable to the task at hand. I mean, trying to feed someone when 3 TVs are going off and dogs are barking, or the garbage is being collected isn't primarily a good thing, to do. It will throw the person off and cause them to have a reaction that may then delay whatever task we're trying to work with them. So that's really important, understanding behaviors, communication aspects, so that we can kind of have control of the social and physical environmental triggers, things that set people off. Non-pharmacological practice, once again, going over that. How do we approach people? How do we, like I always used to say, we want to not have to pull people off the ceiling when they go up there. We want to keep them down. We want to keep it calm, and have practices that we can do to keep people level, so that then controls, or can help control, behaviors or challenging behaviors as we go for. It talks about investment for implementation. What does this mean? What does this mean for an organization, for a facility to invest in this, to implement it, see it through, have buy-in from the staff, because we know it has to be consistent. We can't have maybe 3 or 4 folks taking care of someone on a daily basis, and 2 or 3 of them doing it right and 1 doing wrong, and that sets the person off, and then we have issues. So that needs to come from the top down. Investment for implementation, supervisory, having a good communication so that we can work on that. And that comes with protocols, how to set protocols so that things are consistent, so that there's a plan and those plans are being followed. And then, of course, with everything, evaluating the effectiveness. You have a plan, you're going through it, you're working, on a case-by-case or daily basis, and something doesn't work, we need to move, identify what works, what doesn't work with individuals. We also know that this is a very individual disease. We're all individuals, so it's going to affect each and every one of us, or each and every person in a different way. So we're continually evaluating the effectiveness of this as we move through it. Workforce. So we're talking about staffing recommendations, orientation and training, and ongoing training, and establishing what needs to be done when folks come into the workforce. We've done in the past a lot of different types of training. With the DCPR coming up, it's a more robust online, where people can be trained and then tested on their knowledge as we move through it. But it's important to establish, this training. And it's not only necessarily for direct caregiving or aides or nursing. It could be any staff. If someone works in a facility that has people 65 and older, even if it's not a straight up dementia care facility, you will have interactions with folks that have possibly the start of Alzheimer's and dementia, or possibly even in the mid stage of Alzheimer's and dementia. So it's important that housekeeping folks know this, and kitchen folks know this, just have some training within it. Person-centered information systems, the information systems within facilities, so that we can track histories and track care, and being able to coordinate that. As I stated in the last one, teamwork and interdepartmental, interdisciplinary collaboration. That's a mouthful, I'm telling you. That's a big, long bunch of words. But that's important. We have to have people on the same team. There needs to be buy down from the top, that people, get this going and establish it and make it the culture really of what we have going on. Supporting leadership team, relationships. How are we building relationships between not only the co-workers or colleagues, but also co-workers, colleagues, person with the disease, family members, as we kind of move through. And then having continuous improvement. Once again, that's evaluation, seeing what's working, what's not working. How are we bringing everybody together to make things better for the person with the disease and their family, remembering that they live there. That's their home. That's their their life and their all of their social activities. So it's really imperative that we look at these things. So we have supportive and therapeutic environment. Recommendations there. Sense of community. We talked a little bit. I just talked a little bit about knowing that this is their life. This is their social. This is their home, and we're there to give them a sense of community, to help to build a sense of community with comfort and dignity, remembering that everybody deserves to be treated with dignity, and that's really important as well. Courtesy, concern, and safety. Obviously, making sure their safety is involved depending on the level of the disease, making sure that modifications or things are done in that manner correctly to help folks through this, safely. Opportunities for choice. We talked about that. How do we give folks a choice? So that they are not just being pushed the same thing every day, whether it be food or clothing or entertainment, but allowing them to have meaningful participation, allowing them to have an opportunity to make some choices that gives everybody a good sense of self. It's meaningful to them. As you can tell, next part of that bullet is meaningful engagement. How do we work with the community and their community of these folks that they're doing things meaningful? That is, and once again, that goes back to person-centered. For each individual, person-centered. What do they like? What are their dislikes? What have they done in the past? What have their career been? What are their, what's important to them? And how do we roll that all into meaningful engagement? And then that gives us a sense of community. So we talked a little bit transition and coordination of services, education about common transitions in care. Transitions through the stages, as I talked before. Maybe folks are still at home, they're coming into a facility, they're changing within that. Hospitalization needs, any transitions in the care or things that move, there needs to be, we need to understand what that is, and then how do we move them? Timely communication of information between and across within settings. Once again, goes to communication. We all need to be on the same page so that we can get these things so there's a smooth flow when we're dealing with folks. Person preferences and goals of the person living with dementia. Okay, we got to remember they need to be involved in those types of things. And, they're still a person inside. They still are independent. They still need to have a say when they can have a say. That's really important. So including them all the time as we move through this. Strong interprofessional collaborative team to assist with transition. So how are you doing that within a facility? Is there a team that does that? Is there a protocol that says this is the way we are going to do that? And we'll show evidence-based models. These are all parts of the DCPR training. These are things that are recommendations, but there will be involved actually in the trainings. Let me find here. There we go. Perspectives from Perspectives from individuals living with dementia. So we're encouraging early detection and diagnosis. We're sharing appropriate information and education. Person-centered care, get to know the person, okay? Because getting to know the person helps us maximize their independence. What are their needs? What are their likes? How do we work these things around them? We need practice of patience and compassion, obviously. We're personalizing care to meet individual needs and preferences. Adjusting care approaches to reflect day-to-day needs and abilities. Once again, this is individual. This can change. Things could go along well for a week and then things will change. How are we flexible to pivot on these and have a plan as we move from these? And also then, once again, evaluating, documenting so that people are on the same team as we hey, this worked with Mr. Joe today, but it didn't work, so let's try this. Doesn't mean it might not work tomorrow, but that's what we mean by doing that as well. Providing ongoing opportunities for engagement that have meaning and purpose. We talked about that a lot. Ensure coordination among those who provide care. Train staff on the most current disease information and practice strategies. Once again, these are very important things as we're looking to move education through this, is what's going on? What are the new things that we can do? And we're always learning, obviously. Inform and include individual and new interventions as appropriate. And we're creating a safe and supportive environment that reflects that person and that sense of community. So you can see, we started out person-centered focus and we went around the lovely pie and went through these, all involved in the DCPR. So putting it all together, develop a plan. Okay, we talked about that and there's a lot of repetitiveness as we talk through this, but that's because we're trying to get folks on the same page. Create short-term and long-term goals. Once again, working with people to care plan, to navigate the disease, figure out what we need now, how is it going to change, what are long-term goals as we move through. Include staff, obviously including the staff in how we're going to go through this and build this community. Taking small steps as we move through. Once again, go in the short-term and long-term goals. How do we take care of now, move it through, and continue to build that good person-centered base as we move through this. Get help if needed. You can always reach out to the association, to others, to find out, what do we need to do? Are we struggling with this? Do we need help? Build support. We're building support for the community that these folks are living in. We're building support for that person, for their family. We're collaborating from family caregivers to medical staff to facility staff to building that support community. And recognize and celebrate accomplishments. Move through recognizing staff, being able to find the wins, the little victories, within, and continue to just build on those as we move forward to providing a good community, change, and a better quality of care for individuals with the disease, and also for the caregivers, and also for the staff. If staff feel that things are working well and things are going good, you're going to have an empowered staff and the more training they have, the more empowered I think they'll feel. Getting involved, in-person online programs and services from the association. We have curriculum review available for facilities that already have curriculum and that want to have that reviewed. Essentials is a certification, an online certification program that we have as well. The DCPR will be the new one that's coming out that we've just been discussing. And you can go to alz.org/qualitycare for more information on that as well. And I think we are going to hold off questions for now. And that is the portion of my program. So I will kick it back to Wendy so she can prepare the next segment.
Thanks, Jeff. If you just give us a moment, we're going to change presenters and turn it over to Jen.
All right, thanks, Wendy. And while you guys get all of that situated, and before I get started, I do just want to take a moment on behalf of the Alzheimer's Association, just truly thank all of you that are on the call today, all of our direct care workers, the providers, all the staff that are working tirelessly around the clock during COVID to really protect the health and well-being of everyone that's in long-term care facilities. We acknowledge that this is a tremendous lift. We acknowledge all the sacrifices that you're making. And so on behalf of our organization, we just really want to thank you for that. And so I think we're ready to get started. And like Jeff, I'm going to take myself off of the screen here. Okay, next slide, please. So as all of you participating in today's webinar are acutely aware, emergency situations such as the pandemic present special circumstances and challenges in the delivery of long-term care. Considering that nearly half, 48% of residents in nursing homes and 42% of residents in residential care facilities have Alzheimer's or other dementia, it further complicates the delivery of safe and high quality care given the unique care needs of this population that Jeff really eloquently laid out for everyone. Those living with the disease in residential care settings are particularly high risk for COVID because of their age, decreased cognition, increased likelihood of coexisting chronic conditions, and frequent interaction with facility staff and other residents. They may be unable to follow guidance on social distancing, hand washing, and other preventative measures. They may have difficulty articulating how they feel or explaining the symptoms they're experiencing. And as their environment and routine continues to change rapidly, they become more confused, frustrated, and agitated, all representative of dementia-related behaviors. Under normal circumstances, family members, friends, volunteers, and other caring community members are available to help monitor and assist in meeting those care needs. Multiple staff changes at the facility exacerbated by COVID further challenge a resident with dementia to remain calm during a particularly stressful time. Next slide, please. And as you heard on the very beginning of the call, Jessica mentioned what our mission is and the fact that we do lead the way to end Alzheimer's and other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Unfortunately, Pennsylvania saw some of the earliest devastating impacts that COVID was having on our population, and more disturbing was the lack of focus by our state government leaders to protect our most frail and vulnerable citizens, those that are living in long-term care facilities. So when it became clear the negative impact COVID-19 was having on these those living and working in long-term care facilities, the Alzheimer's Association acted because we have an obligation to protect this most vulnerable population. Nursing homes, personal care homes, and assisted living facilities are on the front lines of the COVID-19 pandemic, and we must do more to support the residents and staff with strong leadership at the utmost urgency by engaging with our appointed and elected state government partners. Next slide, please. So our policy work in Pennsylvania began with raising the level of awareness about the vulnerability of those living with dementia in long-term care settings to the governor, the state departments, and the Pennsylvania General Assembly. We also conveyed our virtual shift to delivering care, support, education, and other resources, and invited them to share this information through a variety of communication channels. On March 30th, the Alzheimer's Association released an emergency preparedness guide, which my colleague Kellie Butsack will spend a little bit more time reviewing in a few minutes. But the guide was aimed at non-clinical staff needed during a crisis like COVID and identifies important evidence-based care considerations in caring for someone with dementia. This guide was shared with the Governor's Office, Department of Health, Department of Human Services, Pennsylvania Department of Health, the Long-Term Care Ombudsman's Office, and we urged all of them to disseminate the information to all facilities. And we also collaborated with organizations like PHCA in the delivery of these emergency guidelines. We convened discussions with the Office of Long-Term Care Ombudsman with select providers to shed light on some of the challenges being faced and share best practices and strategies for providers, staff, families, and other care providers. We participated in coalition discussions with other advocacy organizations like AARP, Carrie, Senior Law Center, and others, and sent sign-on letters and comprehensive policy recommendations to the governor and other departments outlining concerns and proposed solutions. We submitted written testimony to the Pennsylvania House and Senate committees with 4 overarching policy recommendations. And we continue to have ongoing communication with the governor's office, key stakeholders, and the General Assembly. Next slide, please. So as we worked in Pennsylvania with our organizational and coalition partners, volunteers, and state government officials, we were in constant communication with our national state affairs team in Washington, D.C. We shared our experiences and we learned about challenges other states were facing in this crisis. And this helped to inform the release of comprehensive national policy recommendations the association released on May 11th entitled improving the state and federal response to COVID in long-term care settings, a set of policy recommendations as a means to sound the alarm to urge federal and state policymakers to implement policy solutions to address the dramatic and evolving issues in long-term care settings during the pandemic. They consisted of 16 policy recommendations in 4 general topic areas focusing on testing, reporting, surge activation, and providing additional support. Next slide, please. So under testing, every nursing home and assisted living community must be equipped with the on-site capability to verify that all residents, staff, and visitors are free of COVID-19 infection, whether or not they are symptomatic. Specifically, rapid point of care testing is key to this success. Next slide. Reporting. Reporting mechanisms must be improved. All cases of COVID-19 infections, remissions, and deaths in care communities will be reported immediately and accurately. Additionally, following all appropriate privacy safeguards, this reported data should be freely and immediately accessible. Next slide, please. Surge activation. Care communities must also be able and ready for surges. Any reported cases should trigger careful ongoing monitoring, and if conditions warrant, strike teams will be deployed to the facility to provide needed support until the outbreak is appropriately contained and eliminated. And the 4th topic area is providing support on the next slide. Policymakers must ensure all nursing homes and assisted living communities have full access to needed PPE, testing equipment, training, and external support to keep them COVID-19 free. Since nearly half of residents in long-term care facilities have Alzheimer's or other dementia, protocols should be in place to ensure a person-centered approach to care for those living with the disease. Next slide. So given these national policy recommendations, we continue to focus our policy work building from our early awareness and outreach discussed earlier, and more acutely advocating for policy changes around those 16 national policy recommendations. And since then, we've seen some promising incremental developments. Baseline testing was required for all staff and residents, and it has been completed with ongoing testing parameters following CMS guidance. That said, we believe testing should be done at much more frequency than what CMS guidance outlines using rapid testing, which I'll discuss a little bit further in a moment. Another hopeful development, the Department of Health publicly reports their data by facility name, the number of residents and staff cases, and number of deaths weekly. And for those few facilities either not reporting or misreporting, we're pleased that the department has created a landing page and a series of webinars to assist with data reporting compliance with facilities. We're also pleased that the General Assembly has appropriated a large portion of the CARES Act funding, of which $295 million have been directed to long-term care facilities. And we're also extremely excited through the creation of the Regional Response Health Collaboration Program, or the RICS, through Act 24. And they are providing clinical support, technical assistance, and education to facilities to prevent and mitigate the spread of COVID. The General Assembly also appropriated $175 million of the CARES Act funding to implement the RICS. We are also excited that DOH prioritized PPE in long-term care settings, but additional supplies and stockpiling are needed from the state and federal government to help support the facilities in ongoing implementation. And we're most hopeful around the broader availability of rapid antigen tests and equipment, as DOH announced last week that Pennsylvania will receive 3.8 million Abbott antigen tests from the federal government that will be distributed through weekly pushes to all CLIA long-term care facilities in counties with highest community spread. We're also pleased when the Governor Wolf announced a partnership with Pennsylvania-based OraSure back in August to expand rapid testing manufacturing in Pennsylvania. Next slide, please. So as we look ahead for opportunities to strengthen long-term care policies for those living with dementia, there's several policy areas we will continue to focus on to address not only the acute needs of all individuals impacted by dementia during the COVID pandemic, but opportunities that will also pave the way for high-quality care in the future. Individuals living with Alzheimer's or other dementia are among the most vulnerable living in long-term care facilities. We've seen and heard from families and providers their concerns over marked deterioration associated with social isolation in many residents. Meeting their individual care needs are essential to their overall health and well-being, which is why we want facilities and caregivers to be reunited with their loved ones as quickly as possible, but only when it's safe to do so. There's always risks with in-person visits, but the Alzheimer's Association believes that visitors are appropriate only when long-term care setting has the capability to employ rapid testing for all staff, visitors, and residents, along with adequate and consistent access to PPE for all staff. This will remain as a focal point for the association moving forward with our policy priorities. In addition, RICPs are playing a crucial role in prevention and mitigation efforts by providing necessary infection control, testing, PPE and other supply needs, training, and surge activation support in long-term care settings. We will continue to raise awareness of the important role RICPs play and advocate for additional funding to support long-term implementation. We also are going to continue working with the Department of Human Services and the Department of Health to encourage a dissemination of dementia care standards similar to our emergency preparedness guide, which Kellie will talk about in just a moment, to assist provisional staff in delivery of patient-centered care to ensure the care needs of those living with dementia in long-term care facilities are met during the pandemic and future emergencies. And either through the new formation or utilization of an existing statewide structure like the Long-Term Care Council, we're advocating for the establishment of a statewide working group inclusive of all key stakeholders to bring forward pressing issues for discussion, review best practices, and recommended implemented solutions. And lastly, for the longer term, we must have sufficient trained healthcare workforce trained in person-centered dementia care, especially during emergencies. And to that end, we will be working on policies to enhance existing training standards for direct care workers, adult protective service workers, and first responders. The Alzheimer's Association appreciates every one of you in today's webinar, the Pennsylvania Healthcare Association, and all long-term care providers and staff for your ongoing and tireless efforts to provide quality care while preventing and mitigating the spread of COVID. We look forward to continued partnership with you and as we navigate our work through the COVID pandemic together. And I thank you for the opportunity to be here with you all today. And at this point, I'm going to turn the webinar over to Kellie Butsack, and she is our Associate Director of Programs for the Alzheimer's Association Delaware Valley Chapter. She's going to talk to you a little bit more about our resources that are available to everyone. Thank you.
Thanks, Jen. And good afternoon, everyone. So I'm going to finish out our webinar today to talk about some of the COVID-19 tips and tools we have, all of which are accessible through our website. In fact, on the home page, you'll see links to COVID-19 on just about every page of our website. So it's very prominent for anyone to access. And as Jen and others have mentioned already today, we have a lot of different tips and tools on our website. I'm going to start out by just mentioning some of the things that we have available to family caregivers. And resources for families include caregiver tips for COVID. Those tips include caring for their loved ones if they are in the home with them. And as Jen and Jessica both mentioned earlier, we know that people with dementia will likely need reminders to follow some of the safety guidelines for COVID. So they may need reminders about, maybe placing signs in the bathroom and elsewhere to remind them to wash their hands, demonstrating thorough hand washing, maybe having alcohol-based hand sanitizer available as a quick alternative. We instruct caregivers at home to maybe consider reaching out to their pharmacist or doctors about filling prescriptions for a greater number of days to reduce having to go to the pharmacy every 30 days. Maybe they can turn some of those scripts into 90-day plans. Another important point for families taking care of loved ones at home is making alternative plans for the person with dementia. If things happen or change because of COVID, perhaps we know early on a lot of the adult daycare centers and respite providers were closed during COVID. So do the family members have alternative plans when they can't access the resources that they normally use? And also making alternative plans for care management if, God forbid, the primary caregiver in the home should become sick themselves. So they have their loved one at home with them, and then they become sick, or another family member in the home becomes sick. What is the alternate plan to provide care for that loved one? We also provide tips on caring for loved ones if they're using home-based services. Again, making sure that they're in communication with the home health care provider, making sure they understand what the protocols are to reduce the spread of COVID, checking a home healthcare professional's temperature before they enter the home, asking them if they've been exposed to anyone, because of course they are seeing multiple clients and going into multiple homes in the course of their day, ensuring that their healthcare professionals coming into the home are washing their hands and following the safety practices, wearing a mask, all of those things if they have professional care coming into the home. We also have tips for family members if their loved ones are living in long-term or residential care settings. And again, a lot of that has to do with making sure that they're communicating with your facility staff. What are the procedures that are in place? What are the protocols? How are visits being handled? We know that we can't visit in person. Are they able to work with your facility staff to do a FaceTime or outdoor visits or window visits? You know, what are the options for them to kind of minimize the isolation that we see with this pandemic? And then, of course, we have tips on what to do if a residential facility has reported incidents of COVID-19. And then we also have general tips for staying healthy. Again, wearing the mask, washing the hands, and making sure that we're doing all that we can do to mitigate the risk and incidence of COVID-19. Some other resources we have for families, we have a blog site with FAQs from families that are facing Alzheimer's during a pandemic. The blog features answers to frequently asked questions from families. And we also have articles in our news section that address dementia and the difficulties that people are experiencing during the pandemic and tips for those facing those challenges. It's important that everyone know that our 24/7 toll-free helpline, and you see the number on the screen in this slide, is available to anyone, anytime, for any reason. Not just family members, not just the public with questions. It's also available to professionals and to you and your staff in the long-term care setting. Our 24/7 helpline is also available through translation service in over 200 languages and dialects. So even, direct care staff or family members can choose to speak with one of our care consultants in whatever primary language they're most comfortable with. And again, that number is 24/7, 365 days a year, not just during normal business hours. If someone needs to call at night, on a weekend, on a holiday, in the middle of the night, doesn't matter. There is always live care consultants available at that number, as well as you see on the slide, a live chat feature. So please keep that in mind, that that line is available to professional staff as well in the long-term care and community-based settings. We also have another resource for the community and for professionals is our Community Resource Finder, which is provided in conjunction or in collaboration with AARP. This is a snapshot that you see on the slide of what it looks like when you go into the homepage. It's at communityresourcefinder.org, or you can also access the database by going into alz.org/CRF, the acronym for Community Resource Finder. And what you'll see here, it's a comprehensive resource database. And if you look at the different blocks here, you'll notice people can access programs and events being held by the Alzheimer's Association. So right now, all of our programs and services are being delivered virtually. So anyone can click on that first top left-hand block for programs and events, and they can search for virtual support groups that are meeting monthly. They can search for free live educational webinars that we're doing every week of every month. They can go in and search for AARP resources. You can search for care at home. So home care, adult day services, other community services, housing options is where you'll find the long-term care and residential providers, as well as medical services if they're looking for a doctor or a specialist. Also under community services, you'll find lawyers and geriatric care managers and transportation and other things. So just about any type of resource or provider or care option that a person might need can be found here in our Community Resource Finder database. And once you click on one of those options, you can search by zip code to find providers and services in a local area. We also have, which I think is more important to those of you on the webinar today, we also have coronavirus tips and resources on our website for professionals. So you'll see the website link there on the screen. That's what the page looks like when you go there. So you can see at the top of the slide there, in the snapshot of the web page, there is a link at the top that says professionals. So if you go on our website, alz.org, and you click on professionals, you will find our COVID tips for professionals. And some of those tips, I'm going to show you the next slide. A lot of the tips that we have in there for professionals address things like preventing illness in your community, safety measures and things that you should be taking steps to prevent the spread of the illness, monitoring walking and unsafe wandering. And we've talked a lot today. Jeff's entire first half of the webinar today was focused on our person-centered care recommendations. And that could be challenging during COVID because we know that staffing is a challenge right now during COVID. And you may have temporary or external staff coming in to supplement care during COVID. So are we getting those temporary and supplemental staff on the same page as well with the person-centered care? As Jeff mentioned in his presentation, are we communicating care plans with everyone across the spectrum of staff that interacts with our dementia residents? Are we responding to dementia-related behaviors? Are we trained? Are we providing proper training and tools for staff to be able to respond appropriately to dementia-related behaviors? And Jeff talked about that in our practice recommendations. How are we keeping families and friends connected to our residents? Again, I mentioned earlier, do we have other options when we can't visit in person? The COVID-19 resources from the CDC, and also assisting with eating and drinking. Jen mentioned some of the other sections. You'll find a PDF version that you can download of our emergency preparedness tips for persons living with dementia in long-term and community-based care settings. And you'll see a snapshot of that document. The link is on the website in the professional section, and you can download and share that document. It goes into further detail and bullet points, as you can see in the snapshot of these areas of preventing illness during an emergency. Providing person-centered care. Do we know, as Jeff alluded to, do we know the person? Do we know their preferences? Do we know what they like and dislike? And do all the staff know that from shift to shift? We have tips in that document about advanced planning. Are we aware of the person's advanced directions? Can we follow them in case a transfer is necessary? How are we keeping family and friends connected? Telephone, video calls, all of those things that I've mentioned. Assisting with eating and drinking. What are the person's patterns? How can they be prompted to eat or drink? Because we know with dementia, they may not recognize hunger or thirst. So are we aware and meeting that need to keep them hydrated and keep them eating? Do we have verbal, visual, and tactile cues with eating and drinking, and minimizing distractions? Monitoring walking and unsafe wandering, making sure that the residents have safe spaces to walk. But we also want to ensure that they're getting regular exercise through structured activity, even if it means being able to get outdoors now. And of course, finally, observing and responding to dementia-related behaviors. So do our staff have the training to be able to recognize the root causes of behaviors? Is someone acting out in a behavioral way because they are in pain, but they can't verbally articulate it? Do we know the signs to look for to identify pain, hunger, fear, frustration, loneliness? They're all isolated. We're all isolated. Hallucinations, changes in the environment, misinterpreting the environment or what is trying to be communicated by staff. So all of those things really center around person-centered care. And of course, you also see here on the slide that these emergency preparedness tips were developed in collaboration with partner providers. And you'll see that on the website as well, but that's just a snapshot of a lot of the long-term care partners that partnered with us. And that brings us to the end of our final segment. And I think we have just a few minutes, Wendy, to see if there's any questions in the chat to address. And again, I also want to echo what Jessica and Jeff and Jen and my colleagues at the association have said numerous times today. We are so appreciative of what you're all doing in your settings and in your communities. We realize it is very difficult and very challenging, not only for the families and the residents, but for your staff. And you really are the heroes on the front lines, and we appreciate all that you do. And we hope that you will use us as a resource. So thank you.
Thank you, Alzheimer's team, Jessica, Jeff, Jen, and Kelly. We appreciate this great information that you shared with us, and we are opening up for question and answers right now. We do have a little bit of time here remaining, and I do have some questions that we can get started on, and I believe that you did touch on this, but if you want to just provide more information, and yes, we will be sending out the recording and the slides, if not later today, tomorrow. So look out for those, and we'll provide contact information so that you can be in touch with these fine folks at Alzheimer's Association to meet your needs and the needs of your residents. So the question is, does the Alzheimer's Association offer training for professional caregivers?
Jessica, I don't know if, Jessica, are you still on the line, and do you want to address the new program that's coming out?
Sure. Hi. So yeah, we actually do have a new training that Jeff Dauber spoke about at the very beginning, the Alzheimer's Association Dementia Care Practice Recommendations, the evidence-based training. That will be released soon. We don't have a confirmed date yet, but we do know it's getting closer and closer to the release date. So Wendy, if you'd like to even provide my email information when you send information out to participants, if they have specific questions on that training or would like to know just a little bit more in general of how it's set up and it is online, some of that information, I'm happy to take those questions.
Yes, I will be sure to include your contact information, Jessica. Absolutely. And also note that we have a Alzheimer's Association, some other folks will be speaking on an on-demand session for our annual conference. If you haven't signed up for Unconventional, it will be running from November 10th to the 24th. And we are having mostly on-demand sessions because we know that your time is precious and, you know, you can't always get away and you know, during your workday, it's challenging. So these on-demand sessions are going to be available for the 2-week period that you can watch them, you know, early morning, if you have time during your workday, you know, after work, after the kids go to bed, you know, late night, over the weekend. You know, it gives you a lot of time to be able to take in those on-demand sessions. And again, the Alzheimer's Association, Sarah Murphy out of Pittsburgh will be speaking along with some folks out of Florida who have some new initiatives. So I would encourage you to check out that session in particular. But we do have a lot of great sessions scheduled. There are close to 40 now on-demand sessions and 3 live sessions. So just a little commercial there. I apologize for our annual conference. If you haven't signed up, you can go onto the PHCA website and check that out.
And I would just add too, in the meantime, while we're waiting for our brand new evidence-based online training to launch later this month, I would also encourage everyone to please visit the professionals section of our website. There are other tools and options and information there as well. Jeff had mentioned in his presentation the Essentials program that I believe will be linked to our online training, and so you can get more information in the professionals section of our website.
Great, thank you, Kelly. And again, I want to thank, I don't see any other questions. If you do have questions, please type them in. And I will be sending out, you know, the link or the information for Jessica to be in touch with her, and also the slides. And there was so much information here. It's really a lot to absorb and take in. But again, know that we'll be sending that out tomorrow. So don't forget to stay on just a couple seconds here. As soon as I close the webinar, the survey will pop up, and that information and feedback is really helpful to us. And don't forget to you know, keep your eye out for other PHCA webinars coming up. And again, the PHCA virtual convention, which will start November 10th. We have a lot of good stuff planned there. So again, I want to thank you, the Alzheimer's Association team, for presenting on this topic. And I just want to wish everybody a great remainder to your day, and stay well, everyone.
Thank you, Wendy.
Yeah, thanks, Wendy. Thanks so much to everybody that joined.
Our pleasure. Thank you.